Good afternoon, everyone. My name is Daphne Steriatis, and I'm an associate with CAQH CORE. I'd like to welcome you all to today's webinar with CAQH CORE, CMS, and WEDI on the CMS HIPAA Standards Exceptions Request process. Before I hand the call over, I'd like to mention a few logistics. Please note that a copy of the slides and the webinar recording will be posted on the CAQH CORE and WEDI websites and will also be emailed to you tomorrow afternoon. However, you can download the slides now on the GoToWebinar dashboard on the right of your screen. If you have any technical issues or comments, please submit them to the questions panel on your dashboard. Daniel will kick things off with his presentation, and then we'll conclude today's session with a questions and answers period. All questions were submitted during the registration process. So let's get started. I would like to introduce our speaker, Daniel Kalwa. Daniel is a policy advisor with the National Standards Group within the Office of Burden Reduction and Health Informatics at CMS. As part of the National Standards Group, which oversees HIPAA administrative simplification, he is responsible for developing regulations, policy, and guidance related to HIPAA-mandated transaction standards and operating rules. He joined CMS in 2004 and has since worked extensively in developing policy and technology solutions related to medical review, error rate testing, provider compliance audits, standards development, and healthcare administration. Thank you for being here, Daniel.
Thank you. It's good to be here today. So thank you for joining us, everyone. I am here today to talk about the HIPAA Standards Exception Request process. And it's my goal today to go through a little bit about what that means, and to also familiarize everyone with the process as it exists in the regulations, and then talk about a little bit how that works practically. And then we'll answer some of your questions that you sent in at the end. Next slide, if you would. So we're starting here with the regulatory language that essentially defines what we're talking about for the exceptions process. And all of this language can be found in 45 CFR 162940. That's the Code of Federal Regulations. And it's in this section entitled Exceptions from Standards to Perform Testing of Proposed Modifications. And there's a couple of things that I'd like to unpack for everyone as we talk about this definition and what it means practically. The first thing I'd like everyone to note is that it specifically applies to what HIPAA refers to as a modification to a standard. And what that means in context is this process for an exception only applies where there is an adopted standard for a HIPAA transaction. So if there's is no existing standard that has been adopted, then this process wouldn't apply. And that the standards and the definitions of the transactions are all under the HIPAA Administrative Simplification Regulations. I'll also point out that it says organization, so it's not necessary that the people asking for or managing this process are a covered entity, but I'd have to say it's probably likely, since those covered under HIPAA would be most likely to be interested in getting an exception for testing. And that testing part is also very important. This process is not designed for, example, permanent exceptions to do regular lines of business. It is not designed for what you might call non-live pilots or technology or proof of concepts. The idea here is that this exception grants the covered entities that are participating in the exception the ability to test a new version of a standard or even a completely new approach to the standard without having to worry about the compliance requirements for the existing standards. I'd also like to point out that as we go through, you'll note that it's not managed by CMS or HHS. The actual testing process is managed by the entities that are in the exception process. And all this process does is grant those entities permission to utilize a standard other than the one that is currently specified in regulation. And I'll also point out that it's for a limited time, but it's possible that those times can be extended. I'll discuss that a little bit later when we get to how exceptions are granted or denied. And I also want to point out that this is a public process. So if a proposal were to be approved, there is a requirement for reporting, and we expect that both the approval and the eventual report at the end of this process would be shared with the public. Next slide, if you please. Right, so in order to be granted an exception, there's several artifacts that need to be submitted to CMS for review. The first and longest, even though it's only 10 pages, is a document that describes how the standard to be tested compares to the currently adopted standard. So in the regulations, there's 10 things that have to be covered in this document, and I'll point out right here at the beginning that not all of them necessarily apply to all of the exceptions, but they should all be considered, and we, CMS, will be looking at all 10 of these things as we consider a request for an exception. And again, there's many caveats and ifs and buts that I won't necessarily get into today, but I'll also be telling everyone how you can submit questions about the process closer to the end of the presentation. I'll point out, though, that because in regulation there's a requirement of no more than 10 pages, going along may result in the additional information not being considered when we consider whether to grant an exception or not. Next slide, please. Right, so now we get to go through some of the requirements for consideration. Some of these are perhaps more self-evident than others, so I'll hit some of the highlights on ones that I know have been asked about in the past. I'll note first, number one there is the need to describe how it improves the efficiency and effectiveness of the standards. In general, the purpose of HIPAA administration is to either reduce the costs of administrative transactions or increase the efficiency. So that would be one of the first things to be considered. And then I also particularly want to note option 3 there, or requirement 3 there, that it be uniform and consistent with the other standards adopted. Now, this requirement is not necessarily that the standards proposed for testing have to be consistent with the previous standard that you're replacing with your testing. The purpose here is to describe how it will integrate with the HIPAA standards in general, as well as the operating rules, so that we can understand how it would affect, if you like, the entire ecosystem of the HIPAA administrative simplification transactions. And then finally there at the bottom, it talks about being supported by an ANSI accredited SSO or other private or public organization. There's two important things that I'd like to point out there. In general, for HIPAA administrative simplification, the Secretary is required to adopt standards from what HIPAA refers to as standard setting organizations. And one of those requirements is that it be ANSI accredited. The interesting part here, and the thing I would like to point out, is that for an exceptions process, that's not necessarily the case. So if the standard, and it does need to be a standard per se, it doesn't necessarily need to be developed by an ANSI accredited SSO to be considered. Next slide, if you please. Okay, so the next one I want to draw particular attention to is the concept of being technologically independent. The purpose of this requirement is actually twofold. One is under HIPAA, the standards are supposed to apply universally to the covered entities, and they are also supposed to be universally available. So one of the things that needs to be discussed in a proposal is whether this standard, particularly if it's not developed by an ANSI accredited SSO, is available to the public, and whether it's attached to a particular platform or type of technology. So, for example, is it proprietary to a certain type of operating system? Is it proprietary to a certain vendor, et cetera? That is one of the things we're particularly interested in taking a look at. Also, I'd like to point out that for the final one there, incorporating flexibility to adapt more easily to changes in the healthcare infrastructure. One of the goals is always, as we move through the versions, and particularly when we move to a new version or even a new approach to technology, we're interested in seeing that it is a living, active standard that is supported by both the originator and the community, and that there is a systematic approach to updates, errata, and all the various technical fixes that are always required as we maintain standards. Presumably, ANSI accredited standard setting organizations also would automatically have this, but this is called out separately because it is possible that another type of entity would be proposing a standard. And then finally, the last thing that we would look of particular interest is that there's a public participation in the process. And that goes back to the concept of being applicable to the industry, but also technologically independent, in that if it's a closed standard or a closed software or technology approach, it may be more difficult to implement as a standard, particularly as a HIPAA administrative simplification standard. Next slide, if you please. So all of that I just talked about has to be fit in that first 10-page document. The other things that are required next is the actual specifications for the proposed modification. And here we're talking about actual copies of the standards that's being proposed. Now, we understand that there sometimes might be licensing issues or other topics that might make it difficult to simply send a document, but we need to at least understand exactly what specification is being proposed and exactly the version that is going to be tested. Beyond that, there's also a requirement for a testing plan. That's number 3 here, testing of the proposed modification. Again, this is only 5 pages, so it's not meant to be an in-depth testing plan wherein we expect you to go into all of the data elements and how they will be cataloged and analyzed. The purpose here is to tell us what the metrics are by which we would consider this successful. So how do you intend to test this proposed standard that we're going to try out, and how are you going to compare it to the standard which it might replace? So that's primary, but there's also several other things here. So for example, you also need to be clear about the number and types of covered entities, particularly the health plans and the healthcare providers, and also the geographical areas if it's not national, as well as the proposed beginning and end dates of the test. And then finally, and perhaps most importantly, before an exception can be approved, all of the partners participating in exception have to provide written concurrence that they are willing to participate in the exception. And I point this out specifically because a covered entity cannot unilaterally be granted and then impose, if you will, an exception on the rest of its trading partners. This is intended to be a voluntary and optional part of the testing process. So there is an expectation that everyone participating will know well beforehand, and then the public will also know that this test is occurring because the general specifics will be public. Next slide, please. So what happens once the exception request is sent in is that we, CMS, has to review the request, and then based on those 10 criteria, we will decide whether to grant an exception or possibly not. So it's important to keep in mind that the initial exception cannot exceed 3 years. So this really is, at least initially, a time-bounded test to determine the value and efficacy of a new standard. And some of the things that we will be relying on to make the decision is, of course, the documentation submitted by the organization or organizations that are requesting it, the extent and length of time of the exception. With regard to that, that's whether we believe it's possible or reasonable for the length of time requested. And then we may also need to consult with the DSMOs, the DSMOs. Those are the designated standards maintenance organizations, and they are called out in statute and regulation. You're probably familiar with them. The big three or four are X12, NCPDP, and HL7. But we may consult with them or other standard setting organizations to get more input on the breadth and the technical viability of a proposed exception. Next slide, please. So once a decision is made, we'll respond with an official letter, and it'll either be granted or denied. So should the exception be granted, within the letter, it'll indicate by regulation the length of time for which the exception applies. I already mentioned that it can't be longer than 3 years, but it may be less. The trading partner and geographical areas for which it is approved. Again, here it's possible that some of the trading partners or geographical areas may not be approved out of the initial exception, but the rest of it is approved, or any other conditions for approving the exception. One thing in particular that we've heard from various members of the industry and that we would might choose to suggest is additional contact or updates with the organizations that are conducting the test. I'll point out that the regulations don't require any such oversight, but it may be something that the organizations and CMS agree is useful for conducting the exceptions testing. If an exception is denied, again, there will be a letter and it will explain the reasons. Now, I'll point out that these reasons may be technical in that we believe it's not actually a significant improvement or for some other technical reason, but it may also be an issue of business and compliance with the regulations. So, for example, if an organization were to propose something that's not a standard, it's something that's unique to them or unique to them and their partners, that may be something that we would choose not to grant. Also, if an organization in their exception process request failed to include something, so you failed to include the testing plan, that may also be a reason to deny the request. At any rate, in either case, there will be a letter returned to the requesting organization. Next slide, if you please. So what happens when the test is approved, when the exceptions for testing is approved, and it has run its initial time for testing, the organizations are required to, within 90 days, return a report to CMS describing the outcomes of the test. And something I want to specifically point out is that the regulation specifically requires a cost-benefit analysis of the standard. And what that means here in context is what is the value of taking the time and spending the money to move to this new standard versus a standard that is already implemented. So after that, it's possible for the Secretary to extend the exception. And in that case, the Secretary would, upon request, and this is the important part, the organization would need to request the extension. The Secretary, again, via CMS, may choose to grant an exception extension so that it can go longer than those 3 years. But that is not guaranteed at the outset. It's dependent upon the success and the outcome of the report that is submitted. Next slide, please. So in closing, we have released a guidance document that reviews substantially what I went over here today. That is available at the link here on the slide. I am sure there are many, many questions, particularly with regard to specifics of what some of you may be thinking about the exceptions process. I would encourage you to send those to the administrative simplification mailbox. That's where you can direct any questions regarding administrative simplification or the HIPAA adopted standards. And if you feel ready to submit an exceptions request, there's a different mailbox. That's the CMS Administrative Simplification Exception at cms.hhs.gov, or if you prefer to send in a physical copy, you can send it to the address there on the slide. Thank you for this opportunity. I believe there were some questions that the community sent in, and I think we can go ahead and go over those now.
Thank you so much, Daniel. Starting off, the first question, have any organizations successfully completed the HIPAA exceptions process?
Yeah, the answer to that, the short answer to that is yes. The longer answer is this exceptions process has been in regulation since the original 2000 final rule. So it has been a very long time since an organization has attempted it, and even longer since one was successful. To my knowledge, the last successful exceptions process was actually way back during the move from 4010, from X12 4010 to 4030 in the early 2000s. I'm aware of one other exceptions request that was granted, but that was not eventually adopted. That was for an alternative medical code set in the late aughts. I believe that was around 2008.
Next question, please provide the location in the federal final rule that speaks to the HIPAA standards exceptions request process.
Right, so I shared the link to the federal, to the CFR where the actual regulatory language is. I think this question is asking about the original final rule. And if it's all right, I will put that in the chat here, and I can also provide it verbally. All right, so there we go. So the original rule was from 2000, and that's in 65 Federal Register 5312, and the title of that final rule was Health Insurance Reform Standards for Electronic Transactions. And that is almost exactly 20 years ago. This was placed into regulation. And if you're interested, there is a discussion of this process and some discussion on comments from the industry from that time. Next one.
Sure. Will this exempt a payer from sending a HIPAA standard when a provider requests, and how long will the exception be permitted?
I think I covered how the timing works, but I want to reiterate here that a payer, a health plan, as a covered entity, can't by itself just decide to get an exception granted and then require healthcare providers to use that new standard. It's a voluntary process. Everyone is aware of it going in, and as I mentioned, it requires a written opt-in from all of the participants in the process. So you don't have to worry that you won't be aware or have to make changes that you're not willingly participating in to do the test. Next question.
What is the percentage of exceptions expected to be granted?
This one is a hard one. I believe the answer is it should be very low. Well, by volume of the actual transactions that are done per year, it should be fairly low because this is, after all, for testing. Although that still could be a very large number when you think about how many HIPAA transactions are conducted every year. But I just want to reiterate, the goal here is to collect real life data about the viability of new standards, how new standards, if they're a revision of just one that we've already adopted or completely new technology. The goal here is to, with live data, with actual business practices, determine whether it is in fact a worthy successor to what's already been adopted. So like I said, we will be sharing numbers publicly, but I wouldn't have that information right now. At least some of that depends upon the interest from the community and yourselves on the call here. Thank you.
Well, thank you so much for answering those questions that were submitted before the webinar, Daniel. And I know a few people have submitted questions during the live webinar, and we'll work with you privately after the webinar to get that information. Thank you again. This is Sam Holvey from WEDI, and we appreciate the opportunity to be part of this webinar.